Discovery held its inaugural summit on the quality of healthcare earlier today. The issue of affordable healthcare and government's impending rollout of the National Health Insurance Scheme remain burning issues. Well, to give us a lowdown on what came out of the summit and more, I'm joined by Dumani Kula. He's an executive at Discovery Health. Thank you so much for joining us. Dumani, is it a fair assessment to say that your social status determines your access to decent healthcare?
Yeah, first of all, let me just say thank you so much for having us this evening. And the Quality Summit has been one of the pieces of work that we've really been working on for many years now, you know, the evolution of healthcare in the industry. And I think, as you correctly point out, at the heart of it, you know, there are lots of social factors that one has got to take into consideration, particularly in the public sector. And we have, as Discovery Health, been working extensively now with both private sector providers and certainly the public sector to try and and deal with many of those issues that affect the quality of healthcare in South Africa. Now,
I know we've got very limited time, but what is your broad assessment of the state of healthcare in South Africa right now?
The way I will put it, Nompu, is that the private healthcare industry in South Africa is one of our strongest assets. And I think we should all take pride in that. It is one of the things that I think, you know, that it places South Africa in a very strong competitive position, not only in the continent, but really across the continent. And you will know that many of the local healthcare players, including ourselves, are now active in other international markets. And so the private healthcare industry is really an important part of our economy. That said, you know, there are challenges, and I think those challenges are not unique to South Africa. They are not unique to the private healthcare system in South Africa. Those challenges really are a reflection of global issues that countries such as the US and European countries are also struggling with. And at the heart of it, there are two important issues. One is the cost of healthcare, and which many of us will be familiar that the cost of private healthcare in particular has really been rising faster than consumer price inflation. And secondly, one of the issues that we've been grappling with, and it was at the heart of the Quality Summit earlier today, is really the variation in quality, in the quality of healthcare that is being delivered. So whilst we have a very good, high levels of quality, we see lots of variation from hospital to hospital and from doctor to doctor. And so at the heart of today's discussion really was how do we lift up further the quality of healthcare and really work towards making sure that we continue to improve the private healthcare system that we have.
So how did your discussions marry up with government's intention to implement the National Health Insurance Scheme, and how much does Discovery actually support it and work with government now to actually help it be realized?
Sure. We, as Discovery Health, we are firm supporters of what the government is intending through the National Health Insurance. We believe that the objectives thereof are fundamental, and so we support. As you will know, that there are several pilots that are happening across the country that are to inform how the National Health Insurance will eventually operate. We have been embedded in the Pretoria pilot, and we have got a team that has been working actively with the people. And there are lessons that are being learned. And I think as we learn those lessons, we will then see what that National Health Insurance will begin to look like. And so today what we were talking about really, it was heavy on the private healthcare sector, because I think, as you would appreciate, what the National Health Insurance seeks to do is really to merge in some way what the public sector and the private healthcare sector providers are able to offer. And so at the heart of it is that we have to lift up the game, both in the private sector and also in the public sector. In the public sector, there's more issues on quality. In the private sector, there's more issues on the cost of private health care. I think similarly, there's issues on quality that we have to lift up so that when the National Health Insurance eventually comes, when people are wanting to access care, either from the public or the private sector, they will be able to access care that is at comparable levels across the whole system.
All right, Dumani, we don't have that much time, but is there a website or an information site where people can access what came out of the summit today?
So this week, Nompu, is actually it's a full week that is dedicated on quality. So the Quality Summit, which we hosted at Discovery Health this morning, is just one of the things that we're doing. So tomorrow begins a quality conference, a quality improvement conference, which we, in partnership with the Hospital Association of South Africa, which represents really the private hospital groups, and also the public sector is also represented there. We're going to be showcasing some of the quality improvement work that has been taking place across the country, including both private and public sector. So that conference will finish on Friday. On Thursday, we're pleased to be doing or launching what we call the Discovery Healthcare Quality Awards. And there are two prizes now, two sets of awards that we'll be giving out to both hospitals that have been doing great work and also to nurses that have been rendering great service to our clients. And the website to look at is the Best Care Always website. It's bestcare.org.za. And that's where all the information about the quality improvement work in South Africa will be found.
Thank you, Dumani. That's where we're going to have to leave it. That was Dumani Kula. He's an executive at Discovery Health.